Join me, Charlette Stallworth, Vice President of Business Development and Innovation at Stanford Medicine Children's Health, as we engage the brilliant minds driving change in healthcare, unraveling the mystery behind the next medical innovation. Today, our theme is how do innovative therapeutic technologies impact healthcare? And I am so pleased to welcome Dr. Samuel Rodriguez. He is a pediatric anesthesiologist at Stanford Medicine Children's Health. His clinical research involves creating and studying the effects of new technologies on pediatric stress and pain. He is the founder and co-director of the Stanford CHARIOT Program, which promotes the use of innovative therapeutic technologies to improve the well-being of pediatric patients. The CHARIOT program has brought positive change to thousands of children globally, expanding to incorporate innovative technologies such as virtual reality, augmented reality, and interactive video games. So Sam, so happy to have you here today. And want to just start off with the first question. So can you describe integrating innovative technologies such as virtual reality and interactive video games into pediatric healthcare and therapies?
Yeah, this is a super fun opportunity to talk about some of the things that I'm really passionate about and our team is really passionate about. We design, build, adapt technologies to help kids and sometimes even big kids, adults, with some of the most stressful and painful parts of their lives, which is healthcare. What we do is we focus on clinical problems like pain or fear around needles, and we look for technology solutions to help address those problems. You mentioned virtual reality. That's one of the tools we use. That's something people get really, really excited about. And I can just give you a quick example of how we might use that. If we have a kid who comes in and they're really scared of seeing a needle or getting a shot or an IV, what it might look like is we would put virtual reality goggles on them. They would play a fun, simple game to get their mind off the shot or the needle. And, we've done studies and it shows their pain scores are reduced with that kind of thing. When we talk about taking some of these more emerging or advanced technologies and putting them into the hospital system, it is actually kind of a complicated process. Not only do we have to build adaptive hardware solutions for some of the commercially available technologies, but we also have to design clinical protocols in terms of how we make them suitable and for the hospital environment, how we can clean them, how we can sustain a program of dozens or hundreds of pieces of technology within a healthcare system. And then finally, how do we get that beyond our own healthcare system? How do we get it to other hospitals and even internationally to places where these technologies are really needed and kids and adults can really benefit from them? I can go on more.
Yes, but I have lots of questions for you. So maybe let me ask you one other question in addition to many more to come. Can you share some of the key findings from your clinical research on the effects of technologies on pediatric stress and pain? I know that, as a physician with research, you're always looking for clinical-based and real-time evidence to support the work you're doing. We'd love to hear about that.
Absolutely. We just had a collaboration with our general surgery team, a fun paper that just came out by Dr. Stephanie Chow. And what they were able to show was that using, simple virtual reality programs that we designed, they've been able to take over 100 kids in the last few years and get them through minor procedures, most commonly hormone implants, without sedation, without anesthesia. Just using virtual reality and saving them from exposure to a lot of medications with this program. So they published the results and it's a huge success. We had a lot of these patients were even coming to the operating room to have these procedures done previously. And they've been able to show that with these technologies, we can actually do a lot of them successfully in the clinic and still have a very good experience for the patients. We do other research on pain. Yes, we've shown that using something like a virtual reality headset in a healthy volunteer that sticks their hand into a freezing cold ice bucket You can keep your hand in there longer, and your pain scores will be lower if you're using a distraction technology like a virtual reality headset. And we even take it a step further. Okay, so what about virtual reality and you're doing the headset? And what if you're exercising at the same time? Does that help? And for some people, it helps. Some people hate
Wow.
exercise though. So it's not for everybody. Some people are like, I hate exercise and I hate having my hand freezing cold. So not for everybody and not super practical, but a good way to see, virtual reality helps, distraction technologies helps. What are some things we can do to take it to the next level? What are ways that we can even decrease pain and anxiety scores even more? And then finally, we do clinical studies. What does this look like in the clinical environment? And we've shown that using distraction technologies around things like IV placement, blood draws, those things can reduce pain scores and anxiety scores in real patients.
I love that. I was just having lunch with a couple of friends yesterday, and we were talking about how we reduce stress, and exercise is a method that each of us used. And to think of reducing stress with VR and exercise, to me, is really creative. I really appreciate the work you and your colleagues are doing to really, reduce the stress and pain that patients could experience. Can you tell us why you believe it's crucial for healthcare professionals to pay attention to and actively support the integration of innovative technologies into pediatric healthcare?
Yeah, I mean, we all care about kids. We all want to spare kids from pain and anxiety. But how can we do that safely and have a large impact on the most number of patients possible? That's a challenge. We do a variety of things in our program that have allowed us to engage as many clinicians, physicians, nurses, physical therapists as possible. And, one of the key components of our program is collaboration. So even in our core Stanford CHARIOT team, we have a child life specialist, we have a licensed teacher, we have a physical therapist, we have numerous research assistants and research coordinators, and we collaborate with almost every division or department within our hospital system. So that is a real key component in terms of how do we get healthcare professionals interested and engaged, because it is a lot of work, and sometimes it is an extra step to have to go and grab a piece of technology and get it started and troubleshoot it if it's not working. So we really want our healthcare providers as engaged as possible with these technologies in order to get them to kids and actually use them once we put them into the clinical setting. One thing I do, talk about a lot when I'm teaching or educating is, these technologies are super important. They're very helpful in a lot of patients, but the clinician-patient relationship is kind of paramount. And what we see is that, we'll have a kid who's undergoing wound care every day for a traumatic injury, for example. Well, the person, using a headset, like a virtual reality headset, may help them get through that wound care with less medication, less pain scores, less anxiety. But what we see is that they really do develop a relationship with whoever's helping them. So oftentimes it's a child life specialist. With our team, sometimes it's even a research assistant who's coming with them every day and playing games with them, helping them with their headsets and their activities. That clinician-patient relationship becomes very strong. And the technology is sometimes just a way of strengthening that relationship between the provider and the patient, or providing a way of starting that relationship. A lot of kids are interested in video games, for example, but they're hesitant. They're scared of doctors. They're scared of anyone healthcare related. All of a sudden, you're going there. You're playing a game with them. You're engaging them on their own terms, and it can really help to foster and build that relationship, which can be useful down the line.
Yeah, I can really see that, how providing the technology and building that relationships helps to build kind of the health of the patient as well, right? Because they're going to be engaged, and participate in the therapies and not be afraid of them. I think sometimes that fear and anticipation of pain, maybe even psychologically, can cause even more problems. So I think if you're eliminating that up front, you definitely are improving the chance for good outcomes for those patients.
Absolutely.
Is there, maybe just for my understanding, is there a particular age range that you're looking at? We talk about headsets for kids. Are there a particular age of kids that this is better for versus others?
Yeah, so we try to have, we talk about having a toolbox. So as many tools as possible in order to be able to capture the different personality types, clinical scenarios, and age ranges, just like you're saying. So you're not going to be able to go and put a virtual reality headset on a 12-month-old baby. It won't fit. They won't be able to follow instructions. It's not an appropriate solution. So we have a variety of technologies for the younger kids. So we're talking about like 4 and younger. We tend to use technologies that people are very familiar with. You can use videos on a phone, a tablet, and we use projector units that are either mounted to a bed or shine on the wall or the ceiling. And with that, they can watch their favorite show. We even have custom video games that they can play. As you start to get older, kids can follow more complex instructions. A lot of the time, they get big enough where putting a headset on is not too cumbersome. So we usually start using headsets, whether they're augmented reality, virtual reality, around 6 years old and up. And that's usually under close supervision by a clinician or child life specialist, a parent. And so 6 and up is where we can start using those headsets primarily. But there's some cases where we'll use them on younger kids when we feel the benefit far outweighs the risks. Yeah.
Wonderful. And, I probably should have asked for a few definitions up front, for our audience who are listening to this. I want to make sure everybody understands maybe the difference between virtual reality and augmented reality. Would you give those definitions for us, please?
Yeah, I think it's right now it's almost even a little bit of a moving target, but virtual reality traditionally is you're wearing a headset, you don't see any of your external environment, and you're just seeing a video display. Whereas augmented reality typically will have a translucent screen, so you're seeing your external environment and it has superimposed holograms over it, so you can interact with those while still seeing the room around you. And then there's a new term, well, it's a new term, but there's another term out there called mixed reality, which is happening with a lot of the new headsets, where you're wearing a headset that has you can't see your external environment other than through cameras that it has mounted in it. So you're seeing a camera display of your external environment, and it works very similar to augmented reality. And it's something that we're starting to take a huge advantage of for our new programs. And I'll expand on that a little bit, because when we're talking about using something like virtual reality in patients and especially young kids, I would say the most common side effect we see is that kids get a small percentage of kids get more anxious when you put the headset on, because they can't see their parents, they can't see what's happening around them. Well, when we talk about using augmented reality or mixed reality headsets, now we can have an opportunity for them to engage in an experience with holograms or a video display, but still have opportunities to see what's happening around them if that's something that's going to be helpful for them.
That's wonderful. When I think of augmented reality, I think of the old movie Minority Report with Tom Cruise, where he goes into the Gap and there's like this contact lens or something where you're identified and you can kind of see certain things in the store based on, you as an individual. And I'm sure that kind of experience is coming as well, not healthcare related, but still ways technology can be used.
It's a great example.
So let's see. So what are some of the challenges you've encountered in implementing and studying the effects of new technologies in a clinical setting, particularly in the context of pediatric care?
Wow. Yeah. So you talk about taking anything, any technology, and putting it into a hospital setting, there's a lot of challenges. So I consider the hospital environment like a hostile environment when we're talking to like technology experts. We bring a headset in or a projector in, and instantly it gets broken somehow. I mean, it looks like the thing went to the moon. It's smashed. Its buttons are broken. We use very like strong cleaning solutions, so sometimes that will break the lenses or the buttons on headsets. So there's a lot of challenges in the hospital environment. From a hardware standpoint, over the last decade, we've kind of become experts on how do we make things stronger. How do we design cleaning protocols that will allow the units to have some degree of longevity? And then how do we make things look fun and friendly for kids so that it's not intimidating and scary when they see a headset that's coming towards their heads? Even once the technology is strong enough and suitable for the hospital environment, I think that's step one out of maybe 10. Because one common scenario that we've seen in the past is technologies will get deployed into a clinical environment. They'll get used a few times and then they go into a closet and they're never used again.
Yeah.
So the ways we get around that is we really do take a team approach. We're engaging all levels of the hospital team. In the peri-op area where I work primarily, we have a big program with bed-mounted projectors and screens to help kids, go back to the OR and play games as they're going off to sleep with anesthesia. So for that program, we have the units are stored right in the pre-op area where people have easy access to them. We have trained numerous people on how to set them up and made the setup process as easily as possible, because patience in the hospital setting is almost non-existent. It takes me about 30 to 40 seconds to set up a projector unit, and sometimes that even feels like too long. So
Yeah.
making things as easy as possible to set up. And then we have to have a system. So how do we take these units once they're used on a patient and get them cleaned back to the pre-op area in a safe place and then used again? And so we engage kind of all levels of our operating room team to make sure that we have a workflow that is sustainable and scalable for our institution. Some institutions are able to replicate this, but for the most part, I think utilization of the technologies in hospital settings is sustained usage, I think, is one of the biggest problems. And then finally, you talked about research too. Research in pediatric patients in general is very, very challenging, because any parent would know that if someone approaches you and says, we want to do an experiment on your child, will you sign this consent form? That's usually a no. So when we are doing studies on patients, we design them so that they're fun. We have to use clever study designs where sometimes we're doing crossovers where a patient would serve as their own control and they would get the technology one day and not another day or something like that. Or we can do retrospective studies where we're looking at chart review and things like that to get around a lot of the hesitation for parents to enroll children in studies. And then finally, we'll do studies on, if it's something we're doing is like very uncomfortable and painful, we'll do it on healthy volunteers typically, so that we can increase the number of study participants to power our studies sufficiently.
That's wonderful. I really appreciate the creative approaches you're taking to get the evidence, right? Because the research is necessary to help have that foundation of information and data and conclusions to say, yes, this work is effective, this intervention, this VR headset is effective, and that also helps parents and the children in the future. Really like the idea of talking to the parent about the child being their own control, right? A day, like you said, using it, a day not using the devices to determine how the intervention impacts the child. And I think parents could feel really kind of integrated into the process, right? So it doesn't feel like a cold kind of thing, but really like really part of the process that you're incorporating and that you're putting in place. So really appreciate that. I know the CHARIOT program is doing a lot of great work inside Stanford, but also inside the United States and globally. And so could you tell us a little bit about how you address cultural and regional differences in the adoption and the effectiveness of the innovative therapeutic technologies?
Yeah, absolutely. We first kind of, we were always thinking about this a little bit, but it wasn't until we started to have some more international collaboration and usage of our technologies, our software, and our hardware that we really started to have to say, what are some efficient ways that we can either design software or adapt hardware so that it can be used on the most patients possible effectively. Language would be kind of the first example, one of the first examples that we were approached with. At first, we had a fair amount of language in some of our programs, especially like we had like a meditation app for helping older kids calm down and practice deep breathing exercise, which had a lot of dialogue in it. And so what we did was we found translators, and they translated all of the dialogue and into numerous languages, and it was pretty time intensive. But we did it, and it was successful. In future software designs, we've gone to much less vocabulary, much lower language burden, to the point where a lot of our programs have almost no words in them at all, so we don't really have to deal with interpretation. We make the game design, the experience design, very intuitive, so almost anyone can just put the headset on and immediately just start playing or being able to engage in the experience. And that saved us a lot of time and effort for having to translate these into numerous languages. The final thing we've done in terms of addressing like regional differences in adoption and scaling this is we have created and partnered with a nonprofit group called InvinciKids, which we also founded to help us take some of these technologies and get them to different hospitals in different parts of the world, especially places that can't afford them or don't have access to the software or hardware. This partnership has allowed us to take these technologies and get them to the places where they really need them.
That's wonderful. I think it's really important always, but I think in the last couple of years, people have really been paying attention to health inequities and really trying to, as your program is doing, as CHARIOT does, really trying to provide innovative technologies to kids wherever they are is really important. And I appreciate that work and congratulate you all in that continued effort. Can you tell us a little bit? I mean, you talked a bit about how collaboration is key to the program, and I know you're doing a lot of that within Stanford and globally. Can you tell us a little bit more about the collaboration with healthcare professionals, researchers, maybe technology experts when you're implementing the new technologies? Like, how would you onboard a new tech?
That's wonderful. Yeah, so it's certainly different when we're talking about onboarding or sending or collaborating with a group within the Stanford healthcare system and then outside the Stanford healthcare system. Within the Stanford healthcare system, it's a little bit easier because we have a mobile device management platform that allows us to update and track all of our software usage. We have numerous partners within this health system that have a lot of experience using these technologies that we can use as resources when we're onboarding a new group. The biggest challenges come when we're talking about sending this to another health system or another location. Fortunately, we've had a great relationship with the Stanford Office of Technology and Licensing. What they've allowed us to do is develop a licensing agreement where the software we build and design here at Stanford, we can license that at no cost to other hospitals and health systems who can't afford to develop their own software from scratch. And that license agreement is pretty novel for Stanford and probably novel for anywhere. I don't know of any right now. And with that, we've been able to facilitate not only clinical use at other hospitals and health systems internationally, it's been really useful in research agreements and multi-institutional research projects where there's just one less layer of bureaucracy in terms of taking software that we've designed and built and allowing other institutions to use that so that we can collect even more patients, more data to inform our clinical use and our software building in the future.
I just love how innovation kind of spurs additional innovation. So you have the innovative technologies you're wanting to use at Stanford or use at other places. So OTL comes up with a novel or innovative way to license this, right? So I just love to hear that. And I know we're going to see that more and more as healthcare systems and the rest of the world and other industries adopt new technologies, in addition to, virtual reality, AI, and other technologies. I think this is going to be really exciting for us to all see and be a part of. Are there any ongoing or upcoming innovative technologies that you're particularly excited about? And if so, could you provide some insights into them?
Absolutely, yes. There's always a lot of new stuff and toys and programs that we're excited about. One that we recently launched was a silly little piñata game for addressing vaccine fear in kids. So we send this out to our vaccine clinics, and we're starting to send them all over the place. These little tablet-based games that are either paired with a cool red button that kids can smack or a rubber chicken that they can squeeze. And so they play these silly little games while they're getting their vaccines, and then they get a little prize afterwards in order to decrease the fear and anxiety around shots and needles. So that's a fun program, especially as someone who has 3 kids that are getting vaccines every year. Anything to help with that is something that I think most parents and caregivers would appreciate.
Definitely.
So that's something personally. And everyone loves rubber chickens. So the rubber
It sounds really cute. I think I'd like to
it's
try
really
to play that
funny.
myself.
Yeah, I love it. So that's something I'm super excited about. The next thing would be we have a physical therapy gym here in the Stanford Lucile Packard Children's Hospital that we are helping to lead a makeover for and equip with some new technologies, including motion capture and some advanced augmented reality, virtual reality tools. That should be breaking ground in the next 1 to 2 months and hopefully be ready by the late spring or summer. And with that, we're going to really be able to research and implement new clinical tools that have never been used before. So that's really exciting program for us that Dr. Tom Caruso and Ellen Wang and Maria Menendez, they put a lot of work into this, and there's been a lot of red tape that they've been working through to get this done, but it looks like that's going to be going ahead.
I am excited about that. I know we've been working on that for a long time. And although there is red tape, of course, know that, the hospital and administrators are supportive as well. And we're excited to see the impact, the motion capture will have on the therapies for the kids. So I think it's going to be a win all the way around. So could you also let us know how you envision the future of pediatric healthcare being influenced by advancements in, say, immersive technologies, therapeutic technologies, other technologies?
Yeah. So, what does the future look like? The technologies keep getting better. So
Right.
problems that we had maybe 5 years ago and spent a lot of time working on have become very trivial or non-existent in the last 5 years. Like all of the headsets used to be made out of like primarily cloth parts, and were very difficult to adapt to the hospital environment because it's hard to wipe and clean cloth parts. So we would have to like take them apart, and we would have to have our own engineers like redesign face pads and straps for them. And that was taking us so much time. And over time, especially with COVID, they have become more and more plastic, more and more cleanable, more and more wipeable. And so that problem has kind of been addressed externally. One of the problems we have right now is that it's very difficult for us to control what the patient is seeing in a headset. They can control it, but some of our patients are very young. Some of them have a hard time following instructions, and sometimes we want to change what they're seeing. So the ability to control what's happening in a headset has been a continuous challenge for us that we're just starting to get to a point where that's easier and more possible. So, and some of that's coming from our own internal development. Some of that's just, advancement of the technologies over time. So that's something I'm very, very excited about. There is the kind of mixed reality, augmented reality that is getting better and better over time. We really love the idea of being able to take someone in this spectrum of how immersed they are in the headset and change it over time. So you put a kid into a headset, and the needle's coming and they're super scared of the needle. So we can go, boom, you're in virtual reality. You can't see anything that's going on. And they're like, oh, I want to see my mommy. I miss my mommy. Well, boom, now we can take them to augmented reality or a pass-through mode, and they can see what's going on, but still have a little bit of gamification and or experience that's going on to help distract them or take their attention away. Those things are like things we dreamed about, 5 years ago, and are just starting to be practical
Right.
and user-friendly for patients. And then finally, there's AI, artificial intelligence integration. We are dabbling with that. We have this kind of like cool commercially available robot that we play with the kids in the hospital that has some AI capabilities, which is kind of cute. But I think that's going to be something that we'll be able to take advantage of more and more over the coming years. That's
exciting. Really interesting. And you mentioned in the points you just made that it's difficult to control what the kids are seeing in the headset. And I think does that mean, of course, you do have control of the games or whatever that are available in the headset that they would see, but the point at which the game advances, is that the issue?
Yeah, absolutely. So we do have a mobile device management system for all of our headsets. We control exactly what software is on it, and then we can even start specific programs at any time. But let's say a kid's in a program and, super simple. They're stuck in a menu screen and they can't figure out how to click themselves through the menu screen.
I see.
For us to be able to help them get through that is super useful, because a lot of our users, maybe this might be the first time they're ever using one of these technologies, especially if it's an older individual. If it's someone who's like 50 or 60 years old, a lot of them have never even seen this before. So being able to walk them through that and help them through it is very, very useful for us. The other thing is sometimes we want to change the level of intensity in an experience. So let's say we're doing physical therapy and the kid's really engaged in let's say something like Beat Saber, where they're smashing targets really fast. Let's say we want to slow it down for a second. We can't do that easily right now. But probably within the next year, we'll be able to slow it down when we want. Let's say the kid's bored, or we want to increase the level of stimulation. Then we can speed it up for them without them having to go into a control panel.
I see.
Let's say a kid's having a procedure and there's a point where they start to get uncomfortable during the procedure, and we're using a distraction-based intervention. We may want to increase the intensity of the game or experience temporarily. We do this in a very crude way right now, but to be able to do that precisely and for precise amounts of time, it would be something that would be useful for us. And we think we're always making progress on that. Yeah.
Yeah, definitely. I think it's interesting with innovations and new technologies. It's like you're never finished, right? There's always something more as, there are new capabilities being made available. So I love that. I like the idea of not being finished, but continuing to improve and add, different features. Can you tell us a little bit about, how you work within Stanford or any other place when you're primarily focused or were originally focused maybe on reducing stress and pain, but there physical therapy uses and other uses. How do other physicians, other specialties learn about you and decide to integrate these technologies?
Yeah, we do collaborate with a lot of different groups, and we've been around for, I don't know, probably about 9 years now. We're coming up on a decade soon. So around Stanford, we've kind of gotten a reputation as, good collaborators around these types of technologies. So what'll happen a lot of times is there'll be a clinical problem that a group is interested in exploring or addressing through these types of technologies. And then they'll come to us with, hey, we've got this problem. We got these scopes, endoscopes that we want to stick down kids' noses while they're awake and look at their vocal cords. And how can we work on making them less anxious when we do that? We will talk with the clinicians, and we'll send some of our research assistants and members from our team to learn more about the program, work with the clinicians. And then, in terms of funding the projects, a lot of times, sometimes the group that we're working with might have some startup funds, sometimes they might have no funds. And we will, a lot of times, provide funding for a pilot program around that technology. Because we think it's a good use of things we're doing. Sometimes we already have something that exists because we've thought through similar problems before, and we can just say, hey, we already have something for that, and we'll use that. Sometimes it's a research study that they're interested in doing. Hey, I want to know if putting a VR headset on a kid in clinic and teaching them about, diet, will that affect their food choices going forward? And we can help facilitate a research project with them. So around our hospital, it's become, a little bit of word of mouth, reputation. Some people, we have screensavers now too. Yeah, we're on the hospital screensavers. Put your kid in virtual reality. Travel to the
You
moon.
have arrived. You're on the screen.
Yeah, exactly.
Yes.
Exactly. And then, one final thing we haven't really spent much time talking about was our recent push, probably within the last year, to focus a lot more on in-hospital education programs. We've always worked with clinicians and building education programs for clinicians, but now we're really starting to focus more on the patients. And last year we hired a teacher who now uses these technologies like virtual reality to work with patients, especially kids that are in the hospital for a long period of time, in conjunction with our in-hospital school, to do things like virtual field trips. And they can put on the headset and they can go visit Europe, or most commonly they want to visit their house because they're homesick, but they can go to Paris.
That's really neat.
Go to visit the dinosaurs, they can go to space. And then there's some fun education programs where they can learn math or other things within this fun environment. So education has been a really successful arm of our program that is new, and it's really exciting. It's not something that we were really focused on, a few years ago. It's been exciting.
Thanks for sharing that with us. I'm sure the kids appreciate that. And it's really sweet to think they want to look at their house and a trip to Europe and to dinosaurs as well. So
North
all those
Pole, Santa's
options.
workshop, those kind of things. Yeah.
Yes. Yeah. I think, some of us regular adults wouldn't mind doing those as well. So I think that could be a fun way to kind of decompress while at work. So, the people who have joined us today and are listening to our conversation, many of them are healthcare professionals or researchers, or maybe even have been a patient before, and they want to develop tech or have ideas. So what advice would you give to other healthcare professionals, researchers, other people who want to get involved in innovative tech, developing it, executing, finding use cases for it?
Great question. Yeah, I got this question sent to me beforehand, and I wrote down 3 words for this. I wrote down collaboration, creativity, and persistence. So I think collaboration is very, very important. When we first started this program, almost a decade ago, it was like 1 or 2 of us just kind of like running around doing everything ourselves, and it was a lot. It was very difficult. We would affect a few patients, but nowhere near what we're doing now that we've built up a team and we're working with multiple institutions, and we're getting more and more support from the hospital and from the university. So I would say collaboration is the most important. None of us are tech experts on our team, but we know how to talk with experts in software development and build a team and raise money and do research. None of us have skills in all of these areas, but by building a team and collaborating, we've been able to have a lot of success. Creativity, very important. How are you going to initially, who would think that squeezing a rubber chicken, having piñatas explode would be helpful for kids? We just try and find innovative solutions and fun things for kids and use our imaginations to decrease pain. And that's kind of the most fun part for us. The not fun part is the persistence part, where everything you do breaks and doesn't work, and at some point fails. So we've really become a case study in persistence. Things that pretty much everything we've done has failed at some point, and we've just learned from each failure and gotten better. And people say no at first, and then we kind of, okay, what's your concerns? How do we address those concerns? What are some other creative solutions that we can use to get around that? Or maybe that was just a ridiculous idea and we need to scratch that and go in a completely different direction. So being persistent and really learning from your mistakes is really, really key. Finally, we talked a little bit about that clinician-patient relationship as being paramount. So don't expect technologies to solve all of your problems. For a lot of my patients, I can do just as good of a job as calming their anxiety and stress by telling them silly stories and silly jokes, and as I can with the latest virtual reality headset. Sometimes a good clinician-patient relationship plus a technology is even better. So I don't want to discount the importance of that relationship. I think building that should be the first priority especially when you're caring for patients. And then the technologies are a tool that you use to help or even augment what you're doing.
I love that. Your 3 key points of
There you go.
collaborating, being creative. I did write them down. And persistent, definitely the hallmarks of your program. And the relationship, I think, in healthcare is the most important. The relationship with the parent and child and the provider, and like you're saying, using the technology to enhance that and enhance what you're doing versus to replace something. This has been my pleasure to speak with you today, Sam. Wonderful learning about the work you're doing and your team. And I'm really excited about the future of the program and immersive technologies. Any final words you'd like to say before we close?
Absolutely. Yeah, you brought up the parents just now. We didn't talk about the parents because a lot of people are like, oh, I don't want to go into pediatrics. I don't want to deal with kids because I don't want to deal with the parents. So that is a challenge, but it's a fun part of this. So there's nothing better than having, a really anxious family, anxious kid come in, especially for surgery, and then engaging them in like a fun game or experience and having that kid like smiling and happy. And then the parents, like you can see them, like their anxiety goes down. We even did a research study on this. Their anxiety goes down, and it just completely transforms everything to see that kid, driving a, projector-based car back to the operating room and laughing and, throwing batarangs against, trying to capture a, imaginary bad guy. When at first they came in and they were so nervous and their expectation was just crying in fear the whole time. So really seeing that transformation in the parents and the family has been a very unexpected but rewarding part of this program.
I love that. And we will leave it there. Thank
Yeah,
you so
definitely.
much for being with us. Really love this conversation. Look forward to talking to you again soon.
Absolutely. Thank you so much for your time.
Thanks. Bye, everyone. See you next time.